All right, you're watching Front Row with me, Aby Agina, and quite an insightful interview there with the Cabinet Secretary in charge of Health, Mr. Mutahi Kagwe, indicating that the country is prepared ahead of the vaccination of the vaccine, that is the COVID-19 vaccine. And I'd like to get my quick reactions from my panelists, starting off with Dr. Nyikal at our City Center studios. Daktari, what do you make of that reassurance from the minister?
Well, the minister has reassured us of what is going to be done, but I don't get the impression that it has been done. I was also a bit surprised at the minister's hesitancy about the people in leadership getting the vaccination as a matter of assurance to the other people. It's not the issue of jumping the queue, but the people at the leadership, if they get the vaccine, one or two people in top leadership, the people will be reassured. So that hesitation, I didn't actually like it because it has sent some doubt. And when the minister said that if the medics get it, I'll get it. Now, that shouldn't have been.
Dr. Nyikal, in fairness, he is maintaining that the frontline workers should get it first because they are literally on the front.
No. Let me say this. Yeah. It is not one or two vaccines given to a minister or given to head of state or given to somebody. That is not getting ahead of people. Now, that is just to get people confidence that this thing is working and this thing is safe. I think that is critical. If you bring it now, I will take it.
Okay. All right. I don't know if Dr. Chibanzi will take it because he is literally heading the KMPDU, and as well, he's a frontline worker as a doctor. What are your reactions, Dr. Chibanzi?
I think first and foremost is to say that before we even take the vaccine as healthcare workers, we must have elaborate communication to us. We must know how our adverse effects will be handled, in which facilities. And these are issues that I'm talking about that have been healthcare issues that we've brought around throughout this time of COVID. And so we must have that elaborate communication and plan, knowing that if I do get adverse effects, if I do get symptoms, if I do get the disease, even as we're talking about research and collating data, where is all this information being reported to? And I think to say that we are talking of almost 500,000 people being vaccinated in the first phase. I think we don't have more than 1,000 or 2,000 political leaders and government officials in this country, so they can equally, because they're serving the country and they are helping, they're running the country, they should equally be part of this first phase, because that will also build confidence.
But Dr. In fairness, if someone today tests positive, they'll be taken to a facility, and the belief system is the doctors who are handling me should be given first priority.
Well, doctors should be given first, but I said earlier that this is a novel vaccine.
All right.
And even us as doctors still have issues that are yet to be resolved. In regards to treatment, even for COVID, we still have counties not yet being, settling our issues in terms of medical insurance. We still have doctors, by the way, even at the Ministry of Health, who are working in isolation and treatment centers whose contracts have expired, they've yet to be renewed. And so now you're telling them to take, if they get the symptoms, a doctor, a good example, one doctor perhaps who gets the disease out of the vaccine or symptoms, they're out of employment, their contract is expired, which means they don't have medical insurance to go for treatment. Those are issues that are very real. So on the ground, the Kenyan thing is that things are different.
Things are different. Professor Yugu, I can see you smiling. Would you take the jab if they showed up at this hour?
I think, allow me to comment a little bit about vaccination of the healthcare workers.
All right.
And also to react to what the CS said about, when the vaccine comes, then the first group to be vaccinated would be healthcare workers. And based on that, then the government will build confidence on vaccinating other people. Agi, as a researcher, I know that when before the vaccines are rolled out in population, we normally do something called vaccine acceptability studies. Now, these studies, they look at, if I'm bringing this vaccine to this population, what proportion of these people will accept the vaccine?
All right.
I've did a study from the University of Nairobi amongst the healthcare workers in Kenya. It's not yet been published. But what we found out is that about 30% of healthcare workers in Kenya will actually not take the vaccine. So I think this is the kind of thing the government should have done before. And from such studies, they can find out what are the reasons why the healthcare workers would refuse to take this vaccine.
All right. Remember, the CS also mentioned it is voluntary. Let me take it back to Dr. Nyikal. Looking at some of the questions coming in from our viewers, there's a viewer here, Alex Owiti, is asking, can we give it to all MPs and senators? And would also want, as you prepare to answer that question, Professor Yugi, to also prepare to respond to a question around the efficacy in tropical country. But Dr. Nyikal, please go first.
Let me say this. First of all, by the time we start to vaccinate people, some trials have been done.
Sure.
There are strict organizations that check quality. They have checked these things and they have actually been registered even in those countries. I expect that in Kenya also, Pharmacy and Poisons Board has actually looked at the vaccines that we have picked. So when people are hesitant, we go back to what Professor Yugi was saying and then say, why are they hesitant? You heard, for example, Dr. Machonda saying he's concerned about the working conditions, the salaries, and so on. Now, that does not relate to actually the efficacy or the danger with the vaccine, but with a completely different issue. Mm-hmm. So this is why I was saying there would have been need to have done a lot of preparatory work with the health workers, with the public, and with the leaders, everybody, so that, and I think it's not lost. Even when it comes tomorrow, we can start, but there is need to move quickly and actually sensitize people, tell people it is safe, demonstrate that the leaders themselves are not afraid of it, talk to the health workers and say, although there are issues of salaries and working conditions, now we have an issue of vaccines that we need to protect people that will actually reduce their workload. So there is a preparatory phase that I'm not satisfied with.
All right. So, Dr. Nyikal, are you saying the minister is out of touch with the other underlying issues happening in the healthcare sector?
I think the minister, the system moved too fast. Mm-hmm. So the vaccine came, or it is coming, and we have put a lot of emphasis on arrival. I don't think we have put enough emphasis on preparation for it. All right. I can see they have said the level 6 hospitals will get it, then it will go to the regional hospitals. But from what I'm getting from a doctor who is working the system, are those things really true? If I go to Nakuru now, will I find a room where it will be done? These are the staff that have been trained, and these are the people that will come. Remember that this vaccine, for example, it comes in a batch that you have to be open the bottle, you must have 6 people. So you must make sure that people will not come singly waiting. You would probably want to plan it such that when people come, there is a big number, you batch them, break the vial, give the 6, then there are a lot of logistics that are in there. All right,
Dr.
Unless we are not getting it, maybe we need to get it from a technical person and not the minister.
All right. And before we come to Professor Yugi, still tied to what I've just asked Dr. Nyikal, and he brings up a very valid issue around the training component. How important is it in this exercise?
Well, training is very important because one, remember as I said and I keep saying, is that it's a novel vaccine. So you must train the healthcare workers. You must train them on one. Of course, there is the issue of administering, which you've administered like many other vaccines, but what are the adverse effects to be aware of? How do you monitor? How do you record all this information? And how do you cascade it up in terms of even emergency response care? So these are critical issues that, bring on board the research component, the clinical component, and now the delivery component of the vaccine to the healthcare workers and to any other person who will be receiving this vaccine. So I think the cascaded way in which they want to train will take time, because I've read the development, the deployment plan by the ministry, that they want to do training of trainers at the national level and then now scale it down to sub-counties and then counties. And that takes time. The COVID training for healthcare workers was the same scenario. And what happened during that time is that because healthcare workers are not very well trained on COVID response, is that we saw very many cases where patients were being left and healthcare workers not handling patients. So these are issues that are very real. And alluding to what Dr. Nyikal has actually also said, the personnel that are required to actually administer this vaccine, do we have the adequate personnel? We are in a position where, remember, they'll not just be doing the COVID vaccine, there are other vaccines that are normally given that also being administered at the same time. So this will bring an issue of how are we really prepared on the ground? And from as far as I know in the public facilities, I haven't seen in the past 3 weeks, 2 weeks, even this week, at least some form of signage on COVID-19 vaccination or any type of information on COVID-19 vaccination in the public facilities, in the level 4 facilities, even the level 6 facilities.
All right. Dr. Chibanzi believes we are ill prepared. Professor Yugi, I'd like to get your quick reactions as well. And also, if you could tie it in with some of the underlying myths. Some believe that after vaccination, you put the mask away, you stop sanitizing because you are immune to the virus. How true is this?
Aggie, it is not true that when you get vaccinated, then you stop wearing a mask or you stop practicing social distancing. That's not true. For now, the information you know about this vaccine for now is that, number one, remember those who are going to be vaccinated, some of them may actually be COVID positive but not showing symptoms. So they still have the potential of spreading the virus to other people.
But Professor, how do you convince Kenyans? Because they've already had the hard burden of always having a mask on, and they believe this is the silver bullet.
Aggie, what we know for now is that when you get vaccinated, number one, it takes about 12 days before your body starts developing the protection that you need against COVID-19. Now, during that time, because you don't have the protection, number one, you can be infected if you had not been infected with COVID-19. The second thing that I think I want the viewers to understand, we still do not understand fully how long the protection from this vaccine lasts. So some studies show that it can last up to 4 months. If that is the case, then it means that after 4 months you may be having no protection. So you are potentially, eligible to getting infection with COVID-19. So we still have to maintain a wearing of masks, social distancing, until such a time that we will have enough evidence to say otherwise.
And Prof, I'd like you to also comment on the efficacy of this vaccine. There are questions being raised around the tropical countries that the vaccine may not be as efficient as has been propagated.
That's a good question. The efficacy, most of these studies that were done, we didn't actually have enough time to investigate, and get solid data on efficacy from all populations. Normally, when you are developing a vaccine and you do clinical trials, you test people from all populations. For that reason, we are still relying on the data that we have from the studies which were done when the clinical trials for this vaccine was being done. What we know for now is that the efficacy is from 62 to about 80%. And I think that is where the variation is. So depending on which population you are, you could be on the lower side or you could be in the middle on the upper side. We'll have more information when we collect more data as this vaccine rolls out in the tropical countries.
All right. Gentlemen, we are just at the tail end of our discussion at this moment. I'd like to give each of you 2 minutes, just giving us your parting shot as regards to our preparedness as a country and your message to Kenyans. I'd like to start with Dr. Nyikal in just under 30 seconds.
I think that as of now, as what I've heard from the ministry, we need to go back and prepare very quickly and very thoroughly so that it works. To Kenyans, we still must really go by the guidelines we have been using of washing hands, social distancing, and putting on masks. The vaccine will help us in some time to reduce the disease and will be safe. But we cannot immediately say that once we start using it, we stop. Because professors told you, and that's the fact, that it's about 62 to 80%. If you do about 100 people, about probably 20 may still not be protected. But for the larger population, that is good. So we must continue with the guidelines we have. I plead with Kenyans to do that. This is just another armamentarium that we add to our efforts.
All right. Thank you, Dr. James Nyikal. Dr. Chibanzi Mwachonda, your parting shot.
I think the ministry has a lot of work to do. It must involve the healthcare workers and, more importantly, address the issues that healthcare workers have with regards to the COVID-19 vaccine. I'll say it that the ministry needs to renew the contracts of the doctors in the COVID isolation centers, because they're supposed to be the first target of this vaccine. So they must be renewed so that then now they have access to treatment should they need that treatment in terms of once the vaccine is offered. But to Kenyans, more important is that they should keep the guard up. The vaccine is not the treatment for COVID-19. So we don't want to see a situation where those who take up the vaccine then become careless. And Prof has already alluded to and said what will happen even if you're vaccinated. So we must also remember that COVID is still here. And the political class is to, adhere to the guidelines. We've seen political rallies and now we are seeing a rise in the number of cases. So that's going to be a burden on the healthcare workers and the healthcare system in general. All
right. Professor Yugi, you have the last word. And remember, you didn't tell me whether you'll be taking the jab or not.
I'll tell you whether I'll be taking the jab or not next time, Agina. But my last shot is about, as we roll out this vaccine throughout the country, remember that the COVID-19 viruses that are circulating now, there are more than one. We have the original COVID-19 virus, which we believe that the current vaccine is very good in protecting you against. But we also have another variants that are already circulating, especially the South African one. We don't know in this country whether that variant is already here. So as we plan to roll out this vaccination program, I would urge the government to provide the university, like our university support, to do surveillance studies to find out if we have such variants, because it would also help us understand about the efficacy of this vaccine better. Thank you.
All right. Thank you so much, gentlemen. Quite an insightful discussion we've been having here on the front row. And clearly, Kenyans must remain alert, even as the country prepares to receive the COVID vaccine in the country. Well, it has been a pleasure bringing you Front Row. My name is Aby Agina. Until next time, take care.